Doctor, coming back to the fact that somebody has identified that he has a high blood pressure, he or she has a high blood pressure and needs treatment. So, what is the kind of treatment that they go through?
Again, it depends on the degree of hypertension. Initially, when the blood pressure is not too high, it's just marginally high, and the person is young, we would avoid treating blood pressure. We would say that you go for regular exercise, have regular monitoring of blood pressure, rather than going for any medical treatment. Having said that, it is a frequent blood pressure checks that is
Right.
important.
Right.
Like for instance, suppose somebody 50-year-old comes to me with say 140 by 85 and he's otherwise okay, symptom free, then he doesn't need to take any medicines.
Right.
Just a little bit of exercise, regular exercise, and control on weight, avoiding diabetes. This is about all. But once he does require drugs to control the blood pressure, broadly there are two types of drugs. One is called ones that will reduce the stroke volume of the heart, the stroke output, the power which the heart contracts. Now these are beta blocker, calcium blockers, these
Right.
are those type of drugs. And the other type of drugs are the ones which will dilate the periphery,
Right.
so that the diastolic pressure comes
Right.
down. So depending on the systolic or diastolic, whichever is high, we choose our drugs. And we many times use a combination of drugs. By and large, the first drug of choice that we should use to get blood pressure down is a beta blocker. But asthmatics cannot be given beta blocker, so then we use a calcium channel blocker.
Right.
In addition to that, if you want to use a diastolic depressant also, you have to use a ACE inhibitor
Right.
along with beta blocker. So these are jugglery that we have to do depending individual to individual. Broadly, I would say that reduction in the amount of salt that a person takes, and take more water and more greening leafy vegetables. These are the things that we normally advise for mild hypertension.
Right.
And moderate hypertension has to be treated.
Doctor, when we are talking about medicines, do these medicines have a side effect?
Not all have side effects. I mean, as we are developing parallel with development in all other branches of medicine, pharmacology is also very rapidly developing. So side effects are quite minimized.
Right.
But having said that, there is large amount of side effects which are already given in the books as well as in the performer that they give it along with the tablets. So if you read them, then especially like for instance, as I was telling you, beta blockers, if a person is a known asthmatic, we wouldn't like to give him beta blocker because it will provoke asthma. Similarly, like that, you can avoid drugs which are, like for instance, if a person has got established kidney failure,
Right.
we try to avoid ACE inhibitors.
Right. Right.
And if a person is his potassium is very high, then also we tend to avoid ACE inhibitors. So depending on the biochemistry,
individual case, treatment is
there
done.
is no hard and fast rule that one drug is good, or if a drug is good for me, it may not be good
Right.
for you.
It will be on the individual.
It will be on individual.
Doctor, coming back to the usage of drug and dependence on drug, I mean, there is one more aspect that I would like to ask you is hypertension curable, or is it that somebody who is hypertensive, depending on a level, it might be moderate, it might be high, or is it that they get into a maintenance mode for the rest of their life? Can somebody be completely cured of hypertensive?
Well, I think it depends on the elasticity of the arteries. At some point of time between soft to hard, there are various shades of elasticity.
Right.
As long as the blood vessels are still elastic, a lot of reversal does happen. The lifestyle changes do reverse blood pressures.
Right.
Like all this yoga and like the health camps that they have, like in Jindal in Bangalore and
Right.
somebody in Rishikesh. All this will help them to reduce the hardening of the arteries. But your question is very right. If you once put a person on blood pressure medication, the body gets used to it, so it is better to continue unless there is a catastrophic drop in the blood pressure.
Right.
Because these blood pressures are very well tolerated. Most of these medicines are fairly side effect free.
Right.
And patients can tolerate this, but nothing to beat prevention, and that is by methods by which I told you already enumerated.